Occasionally, the number of diseases in a community rises above the expected level, and this may constitute an outbreak or epidemic. Communicable disease outbreaks cause millions of deaths throughout sub-Saharan Africa each year. Most of the diseases causing epidemics in the region have been nearly eliminated or brought under control in other parts of the world thanks to technological intervention. In recent years, considerable effort has been directed towards public health initiatives and strategies through e-health with a potential to significantly impact on the transmission of infectious diseases. Global Epidemic Prevention Platform (GEPP), which is a product of collaboration between Ministry of Health, Ghana Health Service and Korea Telecom, aims at helping the Republic of Ghana prevent the transmission of infectious diseases.
Ghana Health Service and KT, that's Korea Telecom, has signed an agreement in November 2018 to work together on global epidemic preparedness and prevention. The whole agreement is to make sure that Ghana joins the world of nations to make sure that we prevent epidemic in the world. We are going to work together with Korea Telecom to have an app where our nationals will be able to know wherever they travel, what the threats there are, and then get the response that they need in case there's any epidemic in that area. We use whatever is on the app to also build a platform where we will get a very good system to track all diseases or epidemic in the world and also rapidly assess whatever is happening around us in the whole world so that we can keep surveillance over everything that is happening within our sub-region in the world.
As much as possible, day in and out, new infections do come and do emerge. And those that we even are convinced haven't done justice to them, on them, and contained them, they continue coming up. Those are the re-emergence. And the GEPP app will help us to better conduct surveillance, to better detect early and respond appropriately to all these emerging and re-emerging infections. As much as possible, people within the country and people traveling out of the country, if you have this app on any of the mobile phones, either Android or Mac, there will be the potential wherever you are, if you happen to be at a place where there is risk, meaning that there's an outbreak at that area, there'll be push messages to such individuals, and this will enable them know that they are at area where there's risk of infection and what to do to prevent and protect against such risks. There will also be push message to such individuals as to what to do to prevent themselves and protect themselves, the people, from such infections. There will be push message to such individuals as to where to go and seek for help and support should there be signs and symptoms which can be one of the priority disease conditions that we are using this app to prevent and protect against.
The GEPP key functions are to alert app users to be aware of potential infection, to provide app users with nearest hospital information, to report their symptoms to the health authority, to give tools for digitizing health declaration form in case of foreigners.
So as you download the application, there will be a set of questions that will be asked about you as an individual. What the app actually does is that it uses our GPS location to try and tell us a set of information as you move from one location to another place. So for this particular application, it is about you moving from a place, let's say, of no disease to another place of high risk disease. You are exposed to a set of messages. So the application will now send what we call push messages to you. So assuming you move from Ghana to currently, let's say, Congo DR, which is experiencing Ebola. Immediately you get to Congo DR, the application will give you a set of information on Ebola disease. It will tell you what Ebola is, the signs and symptoms, and what you need to do to prevent yourself. So this kind of information will now help you to determine whether you're having the disease or not. If you happen to have some of these diseases or these signs on you, there's a portion on their app that will allow you to click. So assuming you have a fever or diarrhea or jaundice, as you punch them, you can now send it. So you submit that set of symptoms to a nearby health facility. The nearby health facility, based on its ability, will determine whether they can handle you or not. So they will now either decide to give you a set of instructions, or they may need to refer you to a nearby health facility. The idea is that because you have been showing that set of symptoms, the system will now provide a kind of guidance or support for you. If you now come from that place of high risk disease to your former location or a place of low risk disease, by virtue of the location, you will now be informed that you went to a place of high risk disease. So now you are at risk of, let's say, a particular disease. And then it will guide you what you need to be doing. So let's say if it's EBD, you are supposed to go through a period of 21 days looking out for certain signs of symptoms. So if you show any of these signs and symptoms, then you need to now report to a nearby health facility. So this application, what it's actually doing is that it's kind of give information about the health system. It also provides a kind of set of information to the individual about knowing which high-risk areas you are visiting, and also a set of symptoms that you need to exhibit to show that you have the disease and how to prevent yourself.
The GEPP is for strengthening the capacity of governance on disease surveillance and securing global health, while Korea Telecom and Ghana Health Service aim at achieving SDGs through collaboration. The implementation of GEPP will be executed based on the Memorandum of Understanding signed by bilateral parties, Korea Telecom and Ghana Health Service.
Followed by the MOU between Ghana Health Service and Korea Telecom last year, not just only Korea Telecom as a stakeholder, but all the stakeholders such as Ghana Health Service, CDC, WHO, as a consultant, and the Korean government interest as well towards improving Ghanaian health lives was absolutely critical for this successful launching global epidemic prevention project. I am highly excited about this project's impact and how Ghana will be changing as one of the strongest nations in health sector. Collaboration between Ghana and Korea in health sector has seen a great improvement over the years in our quest to improve the diplomatic relations between two countries. The implementation of this project is so meaningful in a way that it is actually the first project led by Korean private sector, Korea Telecom, KT, who contribute to the government of Ghana. Therefore, we now have collaborative efforts of the two governments and private sectors. So I believe it will be the milestone for other stakeholders to engage in the affairs of Ghana as well.
My role is to transform traditional business activities into more data-driven, digitalized ones. KT is in charge of designing, developing, and maintaining the GPP Ghana. Thanks to GHA's strong commitment, we are pleased and grateful to the world's first launch of GPP in Ghana. I expect that this launch will serve as a cornerstone of the global prevention of infectious disease, and that GPP will spread rapidly around the world. Eventually, GPP Ghana will minimize the socioeconomic losses in Ghana by helping early detection and rapid response when the outbreak occurs.
I'd like to strongly recommend use it as a daily essentials. During my term here in Ghana, I have seen so many people suffering from health issues without knowing themselves to have such symptoms. In Korea, there is saying, knowledge is power. But I'd like to change the saying, knowledge is health. It is time for Ghanaians to eradicate suffering from diseases.
I want to appeal to the good people of the country the lovers of technology that you should all try and install the app immediately it's launched onto your laptops, computers, and tablets, so that you will know what is happening around you, and you know also what is happening in other countries, especially travelers who travel across the world. So before you even go there, you know if there's any emerging diseases there, so that you prevent yourself from having such diseases, and then when you come back home, you know what to do.
Ghana Health Service has been mandated to provide and prudently manage comprehensive and accessible health service with special emphasis on primary health care at regional, district, and sub-district levels in accordance with approved national policies.